Hello, good evening, all of you. It's Shivangi here. Today I am going to talk about our topic of guidelines of ICSR, means Individual Case Safety Report, and null flavors, and last one, ICH Efficacy Guideline. So let's start with individual safety, individual case safety report. That means ICSR. That the guideline for this ICSR is 6A 1.7. What this include? Basically, this refers to that format and content of this all submission of individual reports, that of suspected adverse reaction, suspected product, ADR, and identifiable report. That all the specific point, all the single point, it will be included, and it will be submitted through the ICSR. That's and we should say the valid case ICSR too, that it have to specifically five main criteria for valid case. First one, the identifiable reporter. Second one, the identifiable area, that means the adverse drug reaction. Third one, the identifiable suspect, sorry, at least suspected drug, and identifiable reporter. Fourth and last one, our positive attribution. That's the last step actually. There's no required, but it will be sometimes included in it. So that are the main criteria for this all. That's it under the validation criteria. That's we called 6B.2. That's all these should included in the ICSR, means all the report, all the content which will be in ICSR. That's 6.A.1.7, that ICSR. Next we talking about the null flavor. What should be what this is having actually a specific code, that collection of code that not present, some information should be not valid value. If sometimes the information will not available, that is missing, means that don't have any valid value, then we will put through this null flavor as unknown or not known. The lots of the proper value is not applicable, but these known as if patient name we don't know, if patient age we don't know, if birth date we don't know, so we have to put there unknown. That's we call that the primary source, that for some paper doesn't give their privacy, or due to their privacy information they didn't give their birth date, whatever, mobile number, email ID, whatever those issue, that will be that value we don't have. That's why we just put there unknown. That the primary of this is under the 8 null flavor. That means that guideline which under the guidelines of GVP, that means 6A 1.8, that about the null flavor. And next one talking about the ICH efficacy guideline. So it have the basically lots of guidelines. So first one is E2A for the clinical data, clinical safety data management, and E2A R3, that for the E2B R3, that for the data element transmission to the ICSR. And second one, E2B R3 for implementation, that under the data element transmission to electronic or transmission to electronic transmission, that means in the August. Next one, E2C, that for the risk benefit evaluation, risk benefit report evaluation. That's why E2D, that post approval marketing, post approval, but that clinical data safety management, that E2D. E2E for that E2E for pharmacovigilance practices, and the last one for the E6 GCP, the good clinical practices. So that's for our today's. Thank you.